Let's bring in Alberta Premier Danielle Smith for more on this. Hi, Premier. Thank you so much for making the time today.
My pleasure.
So we just heard there Premier Heather Stefanson mentioning a message that we heard repeated throughout the past 3 days, that the premiers want the federal government to respect the jurisdiction of the provinces and territories. But when it comes to infrastructure, they're also calling for a national approach. So how would that work? What's the message to Ottawa?
Well, there are areas of constitutional jurisdiction that do fall to the federal government. Anytime you're building cross-border infrastructure between not only the Americans, but also between our provinces, whether it's rail lines or roads or transmission lines, but pipelines, ports, those are things that fall into federal jurisdiction. And we've fallen behind, quite frankly. We have a huge export market, a continuously growing economy, and yet we've seen just how much it can disrupt the entire country when one port is shut down. So we need to be proactive in finding more ways to get our goods to market. It means something different for each of the provinces. There's different routes and there's different priorities. And that's why we were able to all agree that the federal government's got to help us come to the table and develop a strategic plan so that we can get all of our products to market.
All right, turning to healthcare, and I do want to get back to something that you're mentioning there with the port workers strike. But before we get to that, healthcare, of course, a huge issue in this country. Many ER doctors are speaking out about what they're calling a crisis in your province and your province's hospitals. What is your government doing specifically to address that issue?
A lot. I mean, not only did we sign a 10-year agreement with the federal government, but we have also made historic investments into healthcare. And we're starting a restructuring as well. It was the first thing that I realized when I first got elected, is that year after year after year, we see that our hospitals have not been able to manage surge capacity when they've got an influx of patients during respiratory virus season. And that's not acceptable. So what we had to do is work on reducing the hospital wait times, work on reducing wait times for ambulance, and start expanding the capacity to do surgery so that we can eventually clear that surgical backlog. We're making great progress. Our official administrator who installed to do this work tells me that we should be able to have our backlog cleared by March of next year. So I think that I know people are impatient. I'm impatient, but it's the reason why we had to get started. And sometimes these things, they do require money, they do require investment. Sometimes they just require listening to the front line and implementing their ideas and getting better practices. And so we're going to keep on making those improvements.
Right, and when it comes to listening to the front lines, I understand that the premiers also had a meeting with nurses the other day. They were outlining their concerns, setting limits on the number of hours that would be considered safe for nursing staff or hospital workers to continuously work. That's one of the recommendations. What kind of recommendations are you planning on implementing from them?
There's a couple things I want to take a look at from what I've seen in other jurisdictions. One thing I learned is that Alberta has the lowest number of nurses who are prepared to work full-time. Only 36% of nurses are working full-time, which means the others are part-time or casual. And that's an indication, I think, that we haven't created an environment to work in, that people want to work those full-time hours. So is there some way that we can incentivize that? That would be one thing that I would want to have a look at. The other thing that we haven't done a very good job of, and I would say that this is a collective problem, is making sure that there's a pathway for mentorship and growth as a person enters into the medical profession, starting as a nursing aide and then being able to do on-the-job training or micro-credentialing to become an LPN, and then a registered nurse, and then a nurse practitioner. We need to have more pathways for more people to be able to work in the full scope of practice. A final thing too, and we met with the Pharmacy Association, and they said that Alberta really is a leader in this, in finding new primary care options, allowing pharmacists to prescribe drugs and provide some basic primary care. This is going to require an all-hands-on-deck approach, making sure that every health professional is fully engaged, and that's what we're working on with our new health minister.
Okay, I could continue talking about healthcare with you even longer, but we do want to move on to the BC port worker strike. You are, of course, one of the voices who have been calling on the federal government to take action on it. Reportedly, both of the sides in the dispute have received the terms of a settlement recommended by a federal mediator. So this was the move that the federal government has made so far. What do you make of the response we've seen from the federal government on this issue?
Well, I'm pleased that we're at this point now, but it's been 12 days. I mean, when the Port of Montreal was closed, that was one day before they realized it would be too catastrophic and people had to get back to work. They stepped in very quickly to make sure the WestJet strike was averted, as well as the rail strike. And so to have this linger on for 12 days has been incredibly disruptive, because the Port of Vancouver really does provide the gateway for Alberta, for Saskatchewan, and for Manitoba. I'm hearing about potash being scaled back, mining and developments having to scale back, gasoline and diesel production as well in our own home province as well. That's bad enough, but the perishables, pork products and fresh produce, like this is very serious for our producers, because the longer that these items sit on a dock waiting to be put onto the tanker, sit on the tanker waiting to be offloaded, you end up with spoilage and you end up losing markets. So I've been told that it can take as long as 2 to 5 times the amount of time for the shutdown to get everything back to normal. I would have liked to have seen this earlier. I'm hoping this signals the end of the dispute, but the federal government really does have to do a better job of being proactive on these matters. Ports are essential services, and we have to make sure that we avert these kinds of disasters in the future.
Okay, and just finally here, something that was in the headlines this week is that you've said you support the LGBTQ2S+ community. You were recently photographed with a man at the Calgary Stampede who was wearing a shirt that said "Straight Pride." Pierre Poilievre was also photographed with that man. You said you didn't read the shirt and don't agree with this message. So do you think that this is a hateful message on his shirt?
As I said, I support the LGBTQ community, and I think that you often see that there are people who want to take pictures with politicians as a billboard for their political message. I don't support the message. I know that most other politicians who've had this occur, we go into photo lineups, we're meeting people, we're taking hundreds of pictures. You just don't have time to read every single T-shirt. So I'll be more mindful, and my staff will be more watchful in future. But I think we need to make sure that the LGBTQ community feels supported, and that's what I've always done.
All right, Alberta Premier Danielle Smith, thanks so much for joining us today.
My pleasure.